Everyone, welcome to my channel. I just wanted to talk a little bit about the NCLEX and how I passed in 75 questions. So I did write the exam in April 2020, and I believe I wrote it in about 45 minutes. So I just wanted to go over how I studied, what I studied with, and what worked for me. So to begin, I studied with the Saunders Comprehensive 6th edition textbook. It was actually given to me by my sister, so it wasn't the most up-to-date edition when I did it, but I found the information to still be very accurate, and I didn't have any issues with that. I studied for about 3 months prior to taking the NCLEX. I had maybe a 3-week break in between studying just because I went to BC to visit my sister. But I actually took notes on the entire textbook. So every page of the textbook I have notes on except for pharmacology, and I'll go over at the end what I did for that. So as you can see, I'm just showing that how I split it up, but I did like the Maslow hierarchy of needs. I did like brief little notes on everything just so I could go back and remember, so I didn't have to keep rereading the textbook. Now, the 3 months I was studying, for about 2.5 months of that was me taking notes. And I study well by taking notes, and I do well by reading over it, understanding it, and then reapplying that knowledge and putting it back on paper. So I found that taking the notes really helped me. And I organized it this way, and I actually emailed it to myself, so I had it on my phone and I had it on my email so I could open it whenever I needed. So I'll just kind of go through. I did take some pictures, and I went over all the chapters, and I tried to go in depth as much so I could remember what I needed, but to also not go too into depth that it would be a lot of information to reread over when just reviewing. So I think on here you can see it's about 180 pages of notes. So it seems like a lot of information, but the textbook is about 1,000 pages. So this is about 1/10 of the content. So stuff that I already knew, like gluten-free diet, I didn't need to write anything down, and I just did really brief information to remind me of what I did in the textbook. So again, I read everything, every word in the textbook I read, and I took notes on. And information that wasn't clear to me in the textbook, I went online and I went to YouTube videos. I used Osmosis, and I used, I think it's registered nurse RN, Sarah. She was amazing. I used her website and her quizzes. I used all of her videos. I found that really gave me a foundation for what I needed to learn. So for example, some of this stuff like liver failure, I could remember some of the symptoms and all that of liver failure, but I couldn't really remember everything. So I found what helped me most is understanding what is liver failure, what are the disease processes of it, and why things occur. So like one of the things that helped me remember is, why is there jaundice? Well, there's bilirubin that builds up in the skin because the liver isn't able to get rid of the bilirubin. So that helped me remember, okay, jaundice is liver failure. So then I also made charts, which I found very helpful. So I did a lot of charts. And this I found really helpful. I actually made this chart myself. And I just split up the different solutions IV. So I found it was really helpful to do isotonic versus hypotonic and hypertonic, because I find it can be really a lot of information to take in the different percentages of everything and what is it for. So breaking it down into simple charts like this is really helpful to understand the information. So I'll just kind of go through and show you a little bit more of what I did. So I did it chapter by chapter, as you can see, and then I also broke it down into little sections. And I tried to make the information as digestible as possible. And like some of this stuff is obvious, like CPR 3 to 2, but I just wrote it down so that I could quiz myself afterwards using this review. So you can see I wrote down quite a bit. And again, just writing it down and what helped me. So going over this, how much I studied. So for stuff like this, chapter 15, Erickson, Jean Piaget, Kohlberg, I studied this for maybe an hour. I honestly, at this point of studying, I know it's not that far in. If you look at like what chapter it's on, I don't even know which one. It's not that far in, but I knew based on how I learn and how I think, I wasn't going to be able to memorize this very well. So I pretty much studied the bare bones of this. Some of it I really didn't even memorize. So like agencies of the mind, ID, ego, superego, I briefly studied that because there's so much information to know on the NCLEX that you can't remember everything. So if I could remember the disease process of liver failure and the signs and symptoms of that over the superego of Sigmund Freud, I was going to do that because I felt like it would benefit me more because I could apply liver failure to so many more things. So I think it was really important to study big ideas and to understand how they can translate into smaller things and use that. So honestly, the latency, genital stage, like knowing all these years, I barely studied that because I knew I was not going to be able to remember. And stuff like the separation anxiety and like the school-age children, all of this, pretty much I used my boyfriend's niece and nephew as a reference of what I thought the ages would be. So I thought, oh, what can a child do at 2 years old? And I thought, oh, I'm going to think back to what they were able to do, and I'm just going to kind of guess. And I was actually able to get a lot of it right just from doing that. So it's good to just think of yourself at that age and to think of children that you know and think, oh, were they able to walk at 2? Were they not able to walk? And that kind of can really help you give real life examples to help you remember. Delirium, depression, dementia, important to know. I got a question on this on the NCLEX. I feel like this is something that's you can memorize very fast and it comes in handy. So make sure you do that. I studied a ton of maternal because I did a ton of reading about other people's NCLEX and what they got on it. And a lot of people said they had a lot of maternal and baby. And I knew nothing about it. In my school, I studied at UWO in Ontario, a 4-year nursing program. We really learned almost nothing about maternal or infant nursing. All of this was new to me. I taught myself all of this for the NCLEX. I haven't used it since. I don't work with mothers or babies. I found it very interesting, but I studied it a ton because I knew I was going to get a lot of questions on this, and I did end up getting a lot of questions, so it came in handy. The week-by-week development, I did that very briefly. I went over and I tried to memorize the big years or the big weeks, like 40, like 8, a lot of things were happening. And I thought if I can't memorize this and it comes up, then I'm just going to guess it's one question. Let's see. I studied a lot more of like the bigger systems. So like what happens to a woman during pregnancy, that was very helpful. I also got a question on Nigel's rule for due date, and I barely studied it, and thank God I did because I got the question. JT Pal, I got a question on that. I found that there were a ton. I used UWorld. I just did the one assessment, and I think I was getting like 70s on the tests, and I think on the final assessment I got about a 70 as well. And I got a ton of questions on there about the probable or versus the probable signs of pregnancy. So I would study that. Some of this stuff is more obvious and you just need to read over it once and then you kind of got it. Let's see. I did study the chorioamnionitis. I think I had a question on that. Um, DIC, I studied that really well. One thing, let me see if I can find it that's on here. Eclampsia, incompetent cervix, infections, I also studied that a lot. Let's see. I studied the heart rates. I got a question on that. I actually got like a heart rhythm of the contractions and the baby's heart rate. And I was told to analyze that. So I studied this a lot. It was something that was harder for me to understand, so I spent a lot of time on it. And I also studied a lot on the 4 stages of labor, because that again is something that I had never really seen, so I had to study a lot. I saw a question on placenta previa versus abrupto placentae. Really important to study. Those are big concepts I think that you might see. Yeah, I studied this a lot. The potential issues that you might see. I also studied a lot of pediatrics because I found that I really didn't learn it in school. So this was all, I saw quite a few questions on pediatrics and maternal. I think that was the main areas that I saw on the NCLEX. I had maybe 2 or 3 pharmacology questions. I think I had 1 medication equation that was super simple. And what really surprised me about the NCLEX is that I studied a ton. I had the 3 months. I took notes on the whole book. I did UWorld. I finished almost all the questions on that. I watched YouTube videos. I went online and read blogs. And what surprised me is how much you second guess yourself on the NCLEX because you're so worried about failing, and how the questions can be so simple, but at the same time, so difficult. Like, I had questions where it should have been, okay, that's automatically what it is. I should just know this. But I just was so in my head about it. And normally, I'm pretty good at multiple choice questions. Normally, I get them pretty well, and I can just guess, and then I'm good with my first choice, and it's right. I found when I was doing it on UWorld, I would automatically choose the multiple choice question or the multiple choice answer, and I'd get it wrong. And then that led me to second guess all the rest of my answers because I thought, oh, normally my first guess is right. It's not anymore. But I think the NCLEX is a fine balance of trusting your instinct versus having critical thinking on the questions. And your first choice might be right, but it also might not be. So you have to be careful. But I ended up writing it in about 45 minutes. The whole time I was freaking out before I got into the NCLEX. The whole time I was sitting in the room before I went in, I actually thought I was going to fail. I told myself, I can't believe I'm going to go fail right now. I had no confidence whatsoever. My sister's friend actually failed the NCLEX 2 or 3 times, and she failed once at the maximum questions, and she failed once at the minimum questions. And she was super smart. She's now that she's passed, she's in the NICU. She's a super smart person. But something about it she just couldn't understand, and she couldn't do the questions right. She studied a ton, it just wasn't happening. And I was freaked out that was going to happen to me. So I went in there, I'd psyched myself out the whole time I was doing it. Every question I thought, I'm failing. I got it wrong. And I was at 74 questions, and I thought, I bet I'm going to get 75 and fail. And I got 75, and I finished that question. The screen turned black, and I just remember sitting there almost in tears. I was the first one done, and I thought I messed up so bad that I failed in 75 questions. And I've never felt so horrible in my life. I felt like a failure. I felt like I couldn't do anything right. I felt like nothing was going to go right for me. I'd never be able to pass because I'd studied a ton and I didn't know what else to do differently. I remember I left and the receptionist, she said, "Have a nice day," and I almost wanted to say, "Have a nice day as well. You're going to see me back here in about a month," but I didn't. And I actually went to a church parking lot and I just cried in my car, I think for 30 minutes. And then I drove home and it was about 10 in the morning and I got into bed and I just cried the whole day. And my boyfriend came home and he was consoling me, but it was just, yeah, it was one of the most emotional times of my life. I've never felt that before because I actually had a job lined up. So my job was going to be starting, my start date would be in 10 days after I did the NCLEX. So it was kind of depending on me passing. So it's pretty freaked out that I wouldn't pass and I'd have to tell everybody that I failed. But yeah, that's kind of my story. And I just want to say, if this is you watching this and you've taken the NCLEX and you didn't pass, trust me, if I passed, you're going to be able to. Because I psyched myself out so much and I was able to do it. And I think one of the main things about the NCLEX is not just how you study, it's knowing how to answer the questions. So if you failed and you've studied a ton, you know all your information, you're just not getting it, then I would look into researching how to answer the questions, the psychology behind it, and doing some relaxation, some meditation, because sometimes it's not how much you know, it's how you're answering things. And also, I found that I thought it was like very up to chance on some of it, because I studied maybe an hour of pharmacology. I went over the basics like lithium toxicity. I went over like opiates, beta blockers, calcium channel blockers, diuretics. I went over that. Kind of the stuff that, like the main stuff that you see that you give on the floor. But I knew I wasn't going to be able to memorize anything else. So I just kind of said, screw it at that point. It was the last thing I studied. And I was so stressed. And I felt like I had so much information in my head, I couldn't study a single thing else. So I said, if I get a ton of pharmacology, I get a ton of pharmacology. I'm going to wing it. And I got about 3 questions, and they all ended up being on, I could tell by the name of the drug that it was like a type 2 diabetic drug. So I could tell it was for diabetes, but I didn't know how to answer the question, so I just guessed for all 3. And I thought it was horrible luck that I had 3 questions on the same drug that I didn't know. But at the same time, it was lucky I only got 3 questions on it. And I know some people might get a ton of questions that they've studied a ton about, and some people will get a ton of questions on stuff they never studied. I pretty much all the questions I got, I had studied what it was about, so I was good. But yeah. So let's see here, what else? Yeah, it's good to know the tests, the positions they need to be in. Do they need to have IVs in for it? What is the recovery time? Yeah, this was kind of crazy. I'd never seen this in school, doing ventilator controls. Never seen it before, had to teach myself all of this. I had no idea what any of this was. And it kind of threw me when I was reading it through and trying to study it and take notes on it, because I'll be honest, a lot of this stuff I felt like I taught myself and I didn't learn in nursing school. You learn a lot of the basics in nursing school, like what's DKA and how to do assessments and how to put oxygen on, all that stuff. You don't really learn a ton of this really specific stuff. At least you didn't in my program. I didn't learn a lot of this stuff. So it was a big learning curve to teach myself. And you really have to have, what's the word? You really have to have structure, and you really have to have like self-control, and set limits on studying, because it's hard to start and you're doing like 2 hours a day or 3 hours a day. I couldn't really do more than 3 or 4 hours a day of studying because I was reading the textbook and taking notes, and it was just a lot. Yeah, just thinking back, my heart's racing thinking back to that time. I'm so glad it's over. And honestly, this is the hardest thing. And then once you're done, it's, I don't know if I'd say all downhill from there. First nursing job is definitely stressful. But a lot of this information, I refer back to in my nursing practice. So I have all these notes that I've kept, and I actually go back and like sometimes we'll see things on the floor that aren't very common. I work on CNS, so I work with neurosurgery, general neurology, and stroke care. So we see a lot of very specific stuff and we don't see other things. So when I see something unusual, I can refer back to my notes and think, oh, okay, that's what that is. And that's why we're doing that. And I always have it on my phone so I can look at it, which I find very useful. But let me see. Yeah, and I did anatomy, and yeah, I forgot what some of this was. Yeah, so I took notes on everything. And so that's there. And then here I've got, so I did like a basic chart on insulin. So rapid versus short, intermediate. And I think it's the brand name that they have on the NCLEX. So I studied the brand name, which was different because on the floor we were doing like Aspart, Lispro. We weren't doing Novolog or anything like that. But I briefly studied that. Then I have, this is my pharmacology that I did, air quotes around that, because I really didn't. I started making notes and then I realized how hard it would be. I mean, look at this. There's just so many meds, so many side effects for every single thing. It's just insane. There's no way you can memorize this. There's no way. Things like methotrexate, dexamethasone, lithium, methadone, morphine, hydromorph, the benzos, Tylenol, naproxen. I studied all that. And that stuff, that's information I still use day to day on the floor because it's important and it's big ideas, things that you're going to see commonly. But when I'm looking at like fertility stuff, I mean, I didn't think that that would come very in handy to my everyday nursing practice after the NCLEX. I knew I would just instantly forget it, so I didn't spend a lot of time doing that. And then one thing I also did is I did an even briefer small chart. So this is, I had a really hard time memorizing the electrolytes. So hypoclemia, hyperkalemia. So what I did is I did a chart and I made all of the like signs, symptoms, interventions, all of that. And I still look at this day to day when I need it to review lab results. I found this was very helpful. And then I made little almost phrases to remember the cardiac signs of the electrolytes. So for hypomagnesium, depressed, sitting with tall T. So it's kind of weird. It helped me memorize it. You guys can probably come up with your own, but I found for stuff that I just could not memorize, doing little phrases or like little songs helped. Then I also did like the infant vital signs by stage. That really helped me. And then I did the infections, like airborne contact. So this again is really big, broad ideas and things that I could not remember that I needed to really focus on so I could keep quickly coming back to them. I also find remembering how to don or remove PPE. I don't know why. This is one of the simplest things ever. I just could not remember. I couldn't. Because I would remember hand hygiene and when to do it. I just couldn't remember the order of taking gown, mask, and gloves off. And then I just wrote down, I think these are from Osmosis or Registered RN. Just how to remember these. Presume. This spells presume. Spells probable. And then fetus for positive. Addison's and Cushing's was hard for me to differentiate, so I just did a little note here on how to do it. And then, of course, I wrote down all the electrolytes and what I needed to know. And then here's some very basic drugs. And then here's some. And of course, here I have some diseases, which I wanted pictures for because pictures, I'm a visual learner, it really helped me, especially because a lot of these have very similar, they say like rash, or they say like this type of rash, and I couldn't think of it. So having the picture of the rash helped me remember what it was. And then I also made a chart for hormones, what they do, where they come from, and then again the insulin and the peak onset, general ones. Then of course, here I have little words for how to remember COPD, heart failure, endocarditis. I had the heart rhythms here. I didn't study heart rhythms too much. I did take an ECG course in first year, so I just had a general little gist so that I could remember what everything was. And here, this is again the drugs and kind of how I studied just the endings of the important stuff. You can see I kind of gave up after a while writing things in because it was just too much. And this is from Registered RN, I believe, her video. I think this is just a picture of the base and how to do that. But yeah, so that's kind of how I studied, about 3 to 4 hours every day. I tried to not stress myself out too much about it. Of course, by the end, I was freaking out, and I kept wanting to push my date back, but I'd studied for 3 months. I had that job I was going to be getting, so I thought I can't do it anymore. I just have to jump off and just do it. And I did it about 8 in the morning, and the day before, I just relaxed. I studied the most basic things, like the lab values, the stuff I really knew, and I just went over it to give myself some confidence. And then I just relaxed. I watched TV. I hung out with my boyfriend. I had a good dinner. Tried to get some good sleep. The next morning, I think I went at 8 a.m. And I remember sitting in the testing parking lot, and I was freaking out. I had no idea where to go in because the door for the testing area was kind of behind the building. And I was sitting there freaking out. And and then I went in and I did it. And I thought I failed, but I guess it ended up working out. So I've now been on my unit for about 10 months now. But so I just wanted to kind of show you guys how I did it. That's all the testing materials I used: Saunders, UWorld, and then those YouTube videos and channels. Yeah, but I know some people studied in 2 weeks and they did it. I'm somebody, it's hard for me to memorize a lot of stuff, a lot of content at once. And a lot of this information I'd never seen before. So it wasn't easy for me to memorize some of this. So that's why it took me a very long time. And I also paced myself. I did like maybe 1 chapter a day or 2 chapters a day of the textbook. And I did all the quizzes. And I took notes on all the quizzes and I did all of that. Watched a ton of videos. One thing I really recommend is watching videos, because it gives you a break. For one, instead of reading, you can sit down and watch it. It engages your visual side, and it can just really help sink in the information when you see it in a few different ways. And if there's something that you're just really, you can't memorize, you just can't get it, move on. Especially if you have a limited time to study, just move on. Because trust me, not everything is going to be on the NCLEX. You're not going to see everything on there. And you need to study so much that one little thing isn't going to make you fail if you can't memorize it. Just memorize a lot of the big ideas, things that you can apply to lots of things. A lot of the disease processes I found, lab values, understand the lab values really well, and what will happen if they're high or low, signs and symptoms of that. That's really important. I got a lot of questions on the electrolyte values, and they would say like, oh, somebody's hypokalemic. What are the signs and symptoms of that? So you really have to know those. Yeah, but if anybody has any questions, leave them in the comments and I'll try to answer. And thanks for watching.